Good evening, everyone, and thank you for attending AACP's webinar with Dr. David Shirazi presenting Alpha-Stim in the pain and sleep practice. I'm Shaylin, the Association Manager for the AACP, and I will be the host of the webinar tonight. This webinar is approximately 50 minutes, followed by a 10-minute Q&A session. Please enter any questions you have in the Q&A box at the bottom of your Zoom screen, and we will address them at the end of the presentation. Dr. Shirazi has no conflicts of interest. Registrants can expect to receive a recording of this presentation within 5 to 7 business days, and attendees will receive their CE certificate of attendance within 30 days of the webinar air date. I would also like to briefly mention some upcoming events for the AACP. Our next complimentary webinar will be March 8th with Dr. James McKee and Dr. Thomas Preedy presenting MRI of the TM joint. Also, registration is open for AACP's annual symposium on August 11th and 12th in San Antonio, Texas. Visit aacfp.org to register. Tonight's presenter, Dr. David Shirazi, graduated from Howard University College of Dentistry in Washington, D.C. In 2006, he earned a master's degree in Oriental Medicine and is also a board-licensed acupuncturist. He has completed over 2,000 hours of continuing education in TMD and facial pain, craniomandibular orthopedics, and sleep-disordered breathing. He is the founder of the Bite, Breathe, and Balance Study Group and podcast dedicated to the multidisciplinary approach to treating craniofacial pain and sleep disorders. Dr. Shirazi is the director of the TMJ and Sleep Therapy Center of Conejo Valley in Los Angeles, a state-of-the-art private practice that is limited to the treatment of TMD, craniofacial pain, sleep breathing disorders, and craniomandibular orthopedics. His practice is part of the TMJ and Sleep Therapy Center International family, one of over 65 centers throughout the world. Welcome, Dr. Shirazi, and I will turn it over to you.
Thank you guys for having me. Of course, I love the AACP. I love our members. So many people reach out to me in anticipation for this lecture. So thank you for all the well wishes. I hope you guys got the link. I hope you guys are tuning in. So we're going to be talking about Alpha-Stim in the pain and sleep practice. I use this on nearly 100% of my patients. It is an integral part of what I do. It's so ubiquitous, it's just part of the background. So I want to get you guys on board so you understand. So you guys already saw all of this. I don't need to review it. I'm a dentist. I'm a Chinese medical doctor. I was a sleep technologist for 5 years. I'm a diplomat and a fellow of the board and of the dental sleep medicine. Did a hospital residency in China and Korea. And most of my CE is in ortho, oral facial pain, and sleep. So just some disclosures. I am involved with research. I have no, bias or affiliation towards this product or the company, but they are giving me an honorarium for today's lecture. As she said, I am a center. We're a franchise. We have, I think I'm going to be center number 69. I'm opening up a third center in Las Vegas. So right now I'm in the Los Angeles, California area. And I'm working on my 17th year as a center. So this is what my office looks like. We don't do any general dentistry. So there's no, suction and all the traditional dental stuff. I also have a full sleep lab where we will actually do research on whatever it is. Like we did the orexin 2 antagonist study for Insomnia. I was the principal investigator. But if I can find the staff, we'd like to do more and more research using our 3-bed lab. We have the most sophisticated equipment that exists. And of course, we're using all the technology as you guys are using it. So the Alpha-Stim aid, that's that little device on the woman's belly. it works pretty much immediately. There's no negative side effects. There's no addiction risk because, as you're going to find out, you're just releasing your own endogenous happy molecules. There's no form of accommodation to it where if you don't have it, you're having problems, and very easy to use. And it is, if not the best, one of the best researched pieces of durable medical equipment ever made. And I don't say that lightly. We know that CPAP is very vigorously studied, but it's not really curative. It's just sort of managing things, right? So with this device, it has so many uses. It's so many applications that we're going to discuss that are so common in today's time, especially post-COVID. And just the vigorous studies, the sham studies, the double blind, the placebo control, all of these studies have been done for 40 years. It's not a new product. It's been around. It's passed the test of time. So the main usages, there's two kinds. One's called the AID and one's called the M. So the AID is for anxiety, depression, and it can even help with a little bit of locally and centralized pain. I just went on Google Scholar today and I typed in Alpha-Stim AID, and nearly 43,000 citations came up in 0.1 seconds. So it's been around for quite a while. So in my office, the staff, as soon as the patient comes in, whether they're pain or sleep, and even my functional ortho patients like Alf, the whole concept of Alf is to calm the autonomic nervous system down. So we sometimes put them on our Alf patients because our Alf patients are coming for something much bigger than just functional ortho. But my staff puts it on. They put a little liquid conductor on the earpieces. It goes on the earlobe. And then this is a new buzzword, is your modalities are stacked on top of it, right? So as they have the Alpha-Stim on the earlobe, I'm doing cold laser, we're adjusting appliances, I'm doing acupuncture on the patient. All of these things are going on while they're wearing it. And it isn't negatively affected by all the things I'm stacking. The only reason I take it off if I do prolotherapy injections is because if there's like a drop of blood, the blood could drip onto the piece, and then it basically I have to throw it away. So that's the only thing I don't stack with it. So basically we think we know how it works, just like any modality out there. We have so much research that we postulate what it's actually doing. The way I explain it to my patients is that there is a very, very low ampere circuit created between the earlobes right up to the higher centers of the pain, predominantly, in my opinion, the thalamus, but also the amygdala and hypothalamus. And it's releasing our own endogenous 5-HTP, serotonin, and dopamine, right? So we all understand patients that are on anti-anxiety and antidepressant medication, they don't have a chemical imbalance. This theory is widely been proven false. Okay, there is no chemical deficiency on the majority of patients with anxiety and depression, and even in acute stages. Our brain does not allow us to enjoy happy molecules when we're not happy. Okay, if we're anxious, we're depressed, we're in pain, and we're not sleeping, the brain hoards it, right? And when we are bringing those higher centers of the brain into a homeostatic point, or the closer we get to homeostasis, it's releasing naturally its own stored up 5-HTP, dopamine, and serotonin, right? So we've seen this. We've seen it in QEEG studies. We've seen it in other plasma samples and CSF studies, where really cranial electrical stimulation is engaging the 5-HT raphe nuclei and just getting the body to come into chemical balance as well as energetic balance. And so we know that, and again, we're not making blanket statements. There's always exceptions to the rule. but brain inflammation is the leading cause, outside of trauma, is the leading cause of depression, anxiety, and even pain, right? I mean, what's really brought that into focus lately is the long COVID symptoms we're seeing, especially when they have a loss of smell or loss of memory or loss of brain function. These people are highly inflamed, right? But if before that they were just anxious or depressed, they were inflamed, right, in the brain. So of course, a brain infection can cause brain inflammation. And if you guys don't know, during REM sleep, one of the functions that we have is we have a glymphatic system that's cleaning out the beta amyloid plaques from our brain. And any interruptions in our sleep, whether it's insomnia or sleep apnea, snoring, any kind of arousal or deprivation of REM sleep retards our ability to get our beta amyloid plaques cleaned up. Right? So in this book on inflammation-associated depression, their conclusion was, I think it's chapter 2, a wealth of animal and clinical studies have demonstrated an association between concentration of inflammatory cytokines, IL-1B and IL-6, and TNF-alpha, and depressive symptoms. So when they take all this literature together, they reviewed preclinical and clinical findings that suggest the existence of a distinct inflammatory subtype of depression, which these patients exhibit unique biochemical and clinical features and may potentially experience improved clinical outcomes with inflammatory targeted, in this case, pharmacotherapy. They weren't thinking about natural ways of resolving inflammation in the brain, of course. So coming back to this textbook, I believe this was in chapter 1 on inflammation and anxiety. At the end, we offer an oxidative stress theory, which proposed works perhaps as a sensor of distress, the imbalance of which leads to neuroinflammation and can cause anxiety disorders. So the effects of Alpha-Stim on our neurochemicals is on serotonin, 5-HTP, and dopamine. So in a study that was actually done on med students, they actually got med students to agree to get a spinal tap before and after Alpha-Stim. Okay, I'm not kidding. And maybe they just wanted to experience what a lumbar puncture feels like, but they took their CSF samples as well as their blood plasma, and after Alpha-Stim therapy, their endorphins went up, doubled in their plasma, and over tripled in their CSF. Their serotonin went up substantially in their plasma and CSF as well. That's massive. I mean, you can't fudge these kind of numbers. These are massive numbers that no one would offer you in a psychotropic medication study. So in the use of depression, when we compare it to placebo-controlled studies for psychotropic medication, and I want to just preclude that to say we're talking about published, peer-reviewed studies here, right? The unpublished studies on psychotropic medication have far worse outcomes. They just never published them. Okay, I just want to be clear on that. There's numerous of those, but they kept them to themselves. And the only time we hear about them is when they're sued. So, but when you look at the benefits over placebo, it's shocking. It's absolutely shocking. Whereas you can get over 60% improvement with CES, and I'm talking like sham-controlled Alpha-Stim studies, as compared to the very minor improvements in placebo studies of pharmaceuticals. So when we look at meta-analysis studies for depression, we just see, and these are large effect size, sample size, we see such an improvement for the Alpha-Stim for both anxiety and depression. You wonder why it's not in every doctor's office, especially therapists and insomnia-focused patient clinics. So if you guys are not aware, we have something called a Zung depression scale. That is where patients will rate their depression from the bottom being, I have some slight thoughts once a day, to the most extreme where I think about killing myself every day. And they also have I'm going to tell you what POMS stands for, profile of mood disorders. It very similar to the Zum depression scale. These are what is used in medicine as a way of quantifying patients' reported subjective depression. And they see, again, in those studies, they see a marked improvement with the Alpha-Stim. And I'll even say this, I don't think I posted it here, but there is a study that shows an improvement in insomnia in fibromyalgia patients, right? If any of you have treated fibromyalgia patients and they have something called alpha intrusion, they are one of the most difficult insomnia patients to treat. And they didn't shy away from a study like that. They went right into it. And they showed that they were able to improve their sleep, and even in these fibromyalgia patients, right? So again, in these just profile of mood depression studies, even after just a few weeks of Alpha-Stim, showed a marked improvement in scores and outcomes. So, you've heard the expression, healer, heal thyself. Dentists have a lot of stress, and generalized anxiety disorder is real. And when we look at studies on the subject, they find, okay, well, dentists they're literally doing surgery, dental surgery on a patient that's wide awake, right while they're looking at them eye to eye, and they have to manage staff. And by the way, if you ask any dentist, what's the hardest part of your job, they'll always tell you it's managing staff, right? But in addition to being a businessman and then having a home life as well. So their conclusions were factors such as hostile patients, status dilemmas faced by dentists within the medical profession, and the economic challenges of running a small business in a competitive environment are thought to increase the suicide risk, right? And people were actually surprised. They're like, hey, dentists make so much money. Why don't they have it easy? And they realized the meta-analysis, the multivariate studies show that wasn't the case. So we talk about it. They have done studies on just anxiety in the dental practice. So just for people doing general dentistry, if they're having a challenging time with a patient that they're just anxious, they had a very traumatic experience as a child at the dentist, maybe they were put on a papoose board, and they really, I'm not saying that they don't need time, because they do need time. I'm saying they take a lot of time in the doctor's office so they can ease up on the doctor, so to allow him to get started. So a lot of dental offices that use Alpha-Stim, they'll have the patient come sit in the waiting room for 40 minutes, 60 minutes on the Alpha-Stim before they bring him back and get him numb. Right? And this has really improved their outcomes. These people really benefit from it. So with Alpha-Stim aid that you see in the picture here, it is cranial electrical stimulation. It is a tiny amount of electricity, less than 1 milliampere. If you guys know amperes, if you got zapped with it, you'd hardly feel it. It is FDA cleared for anxiety, depression, and insomnia. And in Europe, it's used for centrally sensitized disorders. We say contraindications are pacemaker and cochlear implant. It's such a low, the pacemaker is just, we assume that that's the reason that we should be concerned about having electrical amperage going across the midline. But I don't think there's a single reported case. I've never, ever heard of it in the 20 plus years I've been doing it. In pregnancy, there are no studies, nothing's ever been tried, but we always are cautious, with pregnant women. But I've never known a reason to be concerned about it. Cochlear implants, that's something, they can't remove it. It's surgically implanted. The tiny bit of electricity from the AA batteries is close to it. So I understand that. So like I said, my staff does this. They wet the electrodes, they put it on the earlobes, they turn it on. We start at the number one setting and we work our way up, right? So if you guys have ever seen the ear acupuncture points, the earlobe is where like the head and the brain is on the earlobe, right? So this, the concept of Alpha-Stim and this homeostasis that we're reaching is in the context of, in Chinese medicine, we're trying to reach homeostasis. That's what we're trying to do all the time, bring the body into balance. The body knows what to do, we just need to bring it into balance. So we always start with level 1. You increase the current slowly. They'll feel a little bit of electrical stimulation going on. All that is we're trying to get enough electricity to jump through the skin resistance on the earlobe before it gets into the meridian. And then that'll go away, right? And then they'll start to feel it, right? So the real contraindications and warning with the device. This is what I tell patients, okay, because it's important that you include them on this. So we never know how much the brain has been withholding their dopamine, serotonin, 5-HTP from them. So we never know how much of a dump we're going to get when we get the Alpha-Stim going. So I always tell patients, what you're trying to get at is to feel a little bit high and spacey, okay? If you don't feel it at all, just crank it up, right? Even if you crank it up to the top and feel nothing, it's still working, okay? On the other hand, if you crank it up and you're like at 2 and you start to feel dizzy, like room spinny, do not take it off, because if you do, you'll feel the room spin for a day, right? We just tell them, take it all the way down, take it down to 1, take it down to 0.5, even take it down to 0. Let it finish its algorithm, and then you won't feel dizzy, right? But that's the only real thing that you need to be conscious of. You need to inform your staff and inform your patients to look out for, is if patients say, because sometimes I'll talk to them and we're having a conversation about how they're doing, and they'll say, whoa, the room just moved a little bit. And I'll be like, no problem, let me take it down. And they're like, no, I like it high. We're like, no, we don't want room spin. We want you to feel high, right? So let's just take it down and let's maintain that high feeling, but not room spin feeling, right? So when we're, like I said, this is something I stack. So we put them in, we set the device for 60 minutes, but I don't have an appointment that's less than 20 minutes other than prolotherapy. So when they're coming in, we set it at 60, we're running our cold laser, we're adjusting the appliances, I'm doing acupuncture, and the whole time the Alpha-Stim is on the patient, okay? You know, I always want them to get more. You can't, other than feeling that high and spacey, that dizziness feeling, you can't overdo it, right? So if you had the thing at the maximum setting of 5 and they're in your chair for 2 hours and they don't, as long as they don't feel that room spinning feeling, there is no negative to it. They could literally have it on all day. Dan Kirsch, who had developed this technology, was out in Texas and donated a lot of Alpha-Stims to the military because of the prevalence of PTSD. And of course, there's a ton of studies on PTSD and Alpha-Stim. And what they found was the wives that had migraines would put it on and would use it more than their husbands. And they would just leave it on all day. Like they would, as soon as the hour would run out, they would just turn it right back on. And like I said, there's no negative to it, right? But these are the ideal sort of dosages. If you can have it at 2.5 or more, 20 minutes will get you the kind of data that we want, the kind of improvement that we see in our data, right? If you're going to keep it below 2, then 40 to 60 minutes to call that a proper treatment. If you just keep jacking it up, like I said, it's doing homeostasis. It's not forcing something along. So treating at higher current levels doesn't mean you get more of an effect, but doing it for a longer duration does. And like I said, if you have the patients who can have it up to 5 and feel absolutely nothing, that's fine. It's still working. And of course, because of that high spacey feeling, do not operate heavy machinery. Okay. So another feeling with Alpha-Stim is that perfect feeling between being just a little bit awake and alert and just relaxed, because it's helping them come into more homeostasis, and therefore their heart rate variability numbers are going to improve as a result. Right. So if we're doing it predominantly to treat insomnia, we actually advise our patients to use the device more during the day because it's inducing the alpha wave, right? And alpha wave is more of a daytime wavelength, brain wavelength. So we want them to use it during the day so that at night they can relax and go to sleep. Now, at the same time, on my severe insomniacs who have just an incredibly hard time falling asleep, any kind, they're just asleep and they just lay in bed and they just can't sleep. They're even thinking too much. They would lay hours. Those patients, I'll have them wear it at night to bed, and it'll help them get to bed faster. If you see it like it's not helping, this is unusual, right? If you have, a patient with like a lot of problems, don't think that one treatment's going to resolve everything. You're probably not doing it enough. If they have a lot of scars, just like in acupuncture, scars will block the current flow. And we're going to be talking about M therapy for treating chronic pain and joint issues. We say after you use the M device, you want to finish it off with a cranial electrical stimulation to kind of calm the nervous system down so that the treatment takes hold a bit better, right? If you're not getting any results, that is unusual because this is a device for clinical use. It works great. If you're not getting any results, then you have to start looking at other pathologies that might exist. And always never give up too soon. Just keep pushing forward. So like I said, there's roughly 200 studies that are very strong, robust studies. If you ever want to look at it, you just pop on their website and take a look at it. Not only is generalized anxiety disorders treated with Alpha-Stim, but even panic attacks are treated with it. And these happen in people in the dental office sometimes. Sometimes they'll react weirdly to an injection. They'll have a flashback to a traumatic experience, and they'll go into this high anxiety mode. And you're not going to resolve it in one session, but you will calm it down in the moment as well, right? So, and in studies, when we follow the patient, it actually continues to work. The vast majority of subjects, down on 83%, showed, substantial, massive improvement. But even after they stopped using it, it kept working, right? And they even help patients get into a state of remission. Like the term remission with anxiety and depression is hardly ever talked about in the clinical literature because most of it is pharmaceutical based. And their whole ethos is these people can't resolve their issues. That's why they have to be on the medication forever, right? So when you talk about a device that's actually resolving and bringing people into remission, we really are talking about something exceptional. So insomnia, honestly, people had problems with insomnia before COVID, but COVID has really taken it to another level. But 4 to 6 weeks for a non-pharmaceutical based modality, I think is amazing. And like I said, it just keeps working after you stop treatment, right? So in this case, these people were followed for 24 weeks and their insomnia was substantially reduced even after they stopped the treatment. So with depression, they need a bit more consistency, right? They need to use it every day, in my opinion. That's why I'm so big on having patients buy one, whether it's they buy it directly from me or they buy it directly from Epi. Um, but the people that are more comorbid with depression, they're going to need more treatment time. And like I said, because it's not addicting, because it's not accommodating, the more you use it, it just keeps getting better, right? There is like, for example, when I use it, for example, let's say my son had a cough for a week, for example, and his cough kept me up, right? So my sleep was crap for a week. And then after he's resolved and everything's better and he's sleeping through the night, now I'm hypervigilant at night and now I can't sleep well, right? So with these patients, where like myself, I will go on the Alpha-Stim and I'll jump to like a 4 and I'll just keep doing it and doing it until I'm at 5, keep doing it and doing it until I don't feel anything. And then my sleep becomes normalized. So yeah, we have a reduction in pain with the M device that we're going to talk about as we combine it with the aid portion. We kind of do the aid as a wash for the mental inflammation part of it. And it just keeps getting better the more you use it. There's no side effects. There's no negative side effects to be concerned about. So it seems to also work because it's working on a more central level. It helps the medications and the everything else that you're doing as well. So it makes people more compliant with their medication treatments or their appliance therapy. Relapse rate is less for medications when you're using Alpha-Stim. And it actually obviously helps people who are doing talk therapy, whether it's CBT or otherwise. So like I said, yeah, it supports psychotropic medications and really seems to enhance it as well. And as well as with talk therapy, we actually see a marked improvement in large studies. 122 subjects is not a small study, but we see a marked reduction in anxiety and depression when they're getting their CBT and they're getting Alpha-Stim. And it lasts, right? Relapse rates are much higher when people get off a medication as opposed to just being on Alpha-Stim. So there's much less of a dependency issue, right? When we look at real world patient use, people that buy it and use it at home, the satisfaction rate, of course, is through the roof. Most people are happy to do it daily and not have any challenges with it at all, no negative side effects. They just keep it with them everywhere they go. They just upset that it times out in an hour, right? When we see the benefits for anxiety, insomnia, depression, and pain, and how people are satisfied with it, it's much higher than anything else that's over the counter. I mean, as you guys know, like CPAP is wildly accepted as the treatment of choice for sleep apnea, has something like a 97% success rate, but has a tolerance rate of 40%. So when we see people praising a DME, it's something else. So as we talked about, pacemakers, cochlear devices, and in pregnant patients, we just lay off of it. It's not worth the risk. It's one of those risk reward situations. It's not worth the risk. We don't have a safety study for pregnancy. It's one of those things where you're like, okay, should we even do it? It's what we're treating, anxiety, depression, and insomnia. We certainly don't want to do anything to risk the baby's health. But again, it's such a gentle thing. You can't imagine that it would hurt anybody. Side effects are extremely rare, mild, and self-limiting. They go away. 0.10%, 0.07%. In my clinical practice, the only issue, I say again, the only side effect that I see is if they crank it up too high, usually it's in the beginning, and they feel a bit room spinny, right? They'll say, "Oh, I'm dizzy." I'll say, "Okay, don't take it off, just take it down." And they're fine. It goes away within seconds. So we, again, another dental anxiety study out of Nigeria, where they found the combination of relaxation and CES therapy reduced dental anxiety and allowed patients to move forward with treatment. And again, trans CES was associated with improved pain results in patients that had orthodontic movements, right? That, of course, runs up our alley. When it comes to the cost of everything else, CBT, trans, magnetic stimulation, drug therapy, the cost of Alpha-Stim is a pittance in comparison. If your patients want to buy it off of you or buy it off of Epi, just, we keep it in our office because they get it every time. Really, the device sells itself. Patients come to us and like, "What's this Alpha-Stim thing? And what can you tell me about it? No one's ever told me about it before." I go, "Really?" And here's the brochure. And I sometimes will loan them out to the patients, especially when they're going through a very rough time. And, a lot of people are passing away. A lot of my patients are saying their families or members are passing away a lot. And so we just want to do whatever we can to help them. Okay. So it's safe, it's easy to use, it's proven effective, it's fast acting, FDA cleared, certified, used by the Department of Defense and the VA for their PTSD patients. This is what it looks like when patients buy it. They get a little box that they can keep it stored. All the consumables they can buy directly from Epi, so they don't ever have to bother you for it. Technically, in America, Canada, it does require a doctor's RX. Other countries like China, Mexico, it's not required. So we can buy it and then resell it to a patient for a small profit. If you don't want to keep inventory, then just tell the patient, just sign the prescription and let the patient buy it directly from Epi. And they warranty it. So it's very easy. You can be as involved as you want to be. So this is what the Alpha-Stim M looks like. So it has on the left-hand side, we've got the Alpha-Stim aid part. And on the right, we have the electrodes for peripheral pain, right? So it comes with these two little probes that you can put on painful joints. It could be for acute, chronic, post-operative pain. By the way, with this picture of this gentleman with lower back pain, it is well established in the literature that lower back pain surgery has a 1/3 success rate, a 1/3 they're the same rate, and a 1/3 they're worse than after the surgery, right? So that means it has a 2/3 failure rate, right? And so this is something that, lower back surgery is performed so commonly. This is something great for people that didn't get the results they were hoping to get after surgery, okay? And there's different ways you can use it. You want to make like an X. So you basically want to create a current that goes across the area you're trying to treat, right? So you would have it like in this X configuration, left shoulder, right lumbar, and then you would switch, left lumbar, right shoulder, or you can go side by side, or if it's lower back pain, you can go front to back and cross the midline as well. If someone is not there to hold the device for their lumbar area, for example, you can just attach these sticky little, what do they call them, patches. I don't use that part in my office because I have the acupuncture. But for those of you that want to help people with not just headaches and facial pain and trapezius syndrome, this is something you can do. Just analyze the pain, where the problem's coming from, where's the pain most exacerbated by, just like you do in your regular pain practice. Go ahead and get a pain scale, a VAS score, and then go ahead, make sure there's no scars or old injuries or any implants, and then start attaching it. And then, like we always say, don't forget about the brain. After you're done, you do an aid, I call it a wash, for at least 20 minutes to help with the brain inflammation and the brain assimilation. For the probes, you would put the little conducting electrode solution on the tips, set the frequency, and just go ahead and run it on the area. Do a big X over the area, like a star, I would say, because an X may not be enough. You may want to do multiple X's. You always have to connect both sides. Otherwise, you're not going to have the microcurrent going from one to the other. And then finish off with the ES. So there's another example of the X for like knee pain. You can even use it in this fashion when you're trying to get the knee pain from the more pelvic region. You can put it on your fingers for upper extremities, neck and shoulders, and on your toes for lower extremities, pelvis and lower back. And like I said, you could cross like that. You can go left to right, front to back. You just want to make a microcurrent going from one probe to another, just like that. It's very straightforward, right? And again, we've done studies on that as well, where we just look at it and go, okay, well, how much cost versus how much pain relief are we getting when we compare it to C2 drugs, Imitrex, Topamax, and things like that, even centrally acting medications like Lyrica for fibro. And again, the cost effectiveness is ridiculous. There's no comparison when you have a one-time fee for an Alpha-Stim versus an annual, $5,000 to $70,000 cost for a medication. And even though you might say to yourself, well, this stuff is covered by insurance, well, you still have co-payments. And if your insurance is paying $50,000 for a drug, well, then guess what? Over years, you're going to be paying a substantial amount in co-payments, and far more than what an Alpha-Stim costs, right? So I invite you to give Josh a call if you want to know a little bit more. Go on their website, alphastim.com. If you want to read some of the studies for yourself. Like I said, you can go to Google Scholar and type in Alpha-Stim aid and just see a plethora of studies. So I want to just leave it out for questions. Any of your questions, I'll be happy to answer them.
Wonderful. Thank you so much, Dr. Shirazi. We did have a couple of questions come in. The first question is, what constitutes 1 week of treatment?
Well, that depends on the practitioner. So you really want to, like in my office, I see my patients in the beginning once a week. So they come in, they leave it on for 40 minutes, let's say. And we want to start them off as high as they can manage while still maintaining the high feeling, but not feeling dizzy, while we're doing everything else. Now, if this was someone that was treating anxiety, depression, insomnia at home, I would tell them, put it on for at least an hour every day, right? If you could do more, and do it earlier on in the day than later on if you're treating insomnia. But if they bought it and they took it home, it's every day. If they're in your office, then it's just, like I said, I stack it with all the other stuff I do on my patients.
Perfect. And can you use it while they are taking anti-anxiety or depression medication?
Yes, as I shared with the research towards about the middle. Yeah, it seems to work synergistically with medications because we're unlocking the body's own natural 5-HTP, serotonin, and dopamine. So they just need less, right? So just start low, start with like a 0.5, start with a 1, let them feel that high feeling, and let them, take it up gradually. But yeah, they can definitely use it. The only things that I tell everyone that they should be concerned about is if you have patients that are bipolar, treated or untreated, they're schizophrenic, they have severe issues, the therapist is having a very hard time managing the patient anyway. These are extremely difficult patients to help. Dipping your toe in, you really want to work under the psychologist that's prescribing these medications, right? And unfortunately, I have patients out here in LA where their regular doctor is prescribing all these psychotropic medications for their bipolar and schizophrenia. They don't know what the hell they're doing. So this is not something I advise anyone to tap into, right? I would not engage with them without the psychotherapist leading the way, if that makes sense.
Okay, perfect. And then I think you had kind of answered this one then already, but do other medications need to be adjusted prior to Alpha-Stim treatment?
It's interesting. So my intention is if the Alpha-Stim is something that they want to purchase and use at home, they need to work with their physician to talk about potentially weaning from their psychotropic medications, right? We know the Alpha-Stim works as a standalone option for generalized anxiety and generalized depression, and it's far superior to medications. But still, that doesn't mean that they don't need their therapist. They still need their therapist, whether it's psychologist or psychiatrist. They need to work with them and find a way of finding a balance that works best for the patient. Medications have side effects, Alpha-Stim doesn't. So my intention is, let's do something that's going to be the most natural way of treating someone.
Wonderful. And can you remind us how often, and can you do it all day?
You can absolutely do it all day. Like I said, when these devices were donated to veterans with PTSD, their wives that had migraines would literally leave them on all day. They had to remember, they had to set a time on their watch that they knew that the hour was up so they could restart it. And there's no negative consequences to that, right? All I say is if you're treating insomnia, then you want to do it more in the beginning of the day where you want to have alpha wave state, and not do it so much later in the evening, unless your insomnia is so severe that you can't sleep without it. And there's always exceptions to the rule.
Mhm. Right. And can you talk more about the SNS and PSNS? Does it activate the parasympathetic or does it break the sympathetic?
Well, that's just it. We don't have a barcode that we can scan on the forehead and find out exactly what it's doing. But when we look at heart rate variability, we see, it gets higher into parasympathetic while they're in the Alpha-Stim. It's extremely calming. It's wonderful. So, if I had to hazard a guess, I would say it's allowing for more parasympathetic. What's very interesting is, you guys know I have a master's in psychology, so I'm into this stuff. I'm into research. They actually think that people who are in a hyper parasympathetic state have a higher tendency for depression. So, but what's interesting is Alpha-Stim still helps with those patients, right? Because again, what we're doing is bringing the patient into homeostasis. Wherever they're at, we're all ending up in the same place, if that makes sense.
I've had patients with addictions, and I was told by the MDs managing them that I couldn't give them nitrous because of how it makes them feel. Does this device fall into that same category?
To be honest, I haven't seen any studies personally on addiction and Alpha-Stim. That doesn't mean they don't exist. But I personally haven't seen them. So I couldn't tell you, off the bat, whether it's indicated or contraindicated. Doctors should be looking at naltrexone for patients with addiction anyway, but when it comes to Alpha-Stim and addiction, I don't know. All the other parts of addiction, the anxiety, the OCD, the insomnia. It will help with those peripheral symptoms, but I couldn't tell you with certainty if it helps with patients with addiction directly. If I had to guess, I'd say yeah.
How to use with TMD patients in general, use the M model?
That's up to you. So I don't use the M model in my practice because I have acupuncture, I have laser, I don't need it. But patients who are looking at the Alpha-Stim and to buy for themselves, they ask me, what's this M part? And I tell them it's for pain. You know, if you still have lingering back pain, shoulder pain, your husband does, whatever, I tell them, I go, if you don't mind doing it, I recommend it. I have one, I'll show you how it works. So it's up to the practitioner. So if you have a very hands-off kind of practice where you're just making appliances, you're doing medication therapy, you're adjusting occlusion and things like that, then if a patient has trapezius syndrome or just myofascial pain issues, you could use the Alpha-Stim M in your practice. You can charge for it if you want to. There are billing codes for this. Or the patient could buy it themselves and use it at home.
And what is the typical fee for doing this?
So we package our treatment, so I just included it into the rest of my treatment. But if I was going to charge for just Alpha-Stim or Alpha-Stim M, I would charge like $75 for the office visit.
And do the patients know what's going on around them? Do you have a staff member in the room with them at all times?
So in the beginning, the first few times we use the Alpha-Stim, there's always someone in the room with them when they have the Alpha-Stim on, because we want to guide them and go, yeah, what you're feeling now, this high spacey feeling, this whoa feeling, that's good. That's good. We want this. There'll come a time when you'll have it on 2 like you do now, and you won't feel anything. That's good. We want to bump it up to 2.5. We want to bump it up to 3 until you get to this feeling again, right? And if they do feel room spinny, you don't want them to panic. You want to go, okay, let's just take it down. Let's not take it off. Let's just take it down. And then afterwards, you know, they're fine. They know what to do. They're experts at it with just one-time use. So after my staff has, you know, done range of motion and all that, I come in and do the acupuncture, do the Alpha-Stim, and I leave the room with the Alpha-Stim and the acupuncture needles in. Right? Very, very safe to do that.
Okay, perfect. Well, I think that was all of the questions that we had. I want to thank you again for the great information, the wonderful presentation.
Thank you.
And just a reminder for attendees, we will send out the recording within the next week.
Wonderful.
Thank you so much, Dr. Shirazi. Have a good night, everyone.
Thank you, everyone, as well. Thank you all for being here with me.